The Roux-en-Y gastric bypass is not a new operation. It's actually been around since the late 1960s. But as the years have gone by, surgical technology has improved, surgical techniques have improved, and one thing is very clear today. Gastric bypass is the best weight loss surgery available today. There's no question about it. Gastric bypass is the best, and it's also the most common weight loss surgery done in America. When we do a gastric bypass, what we're doing is at the very top of the stomach, we're creating a smaller stomach, or what we call a pouch. And we're creating this pouch at the very top of the stomach, so it's about the size of an egg. In a gastric bypass, we staple it off and completely separate it from the rest of the stomach. The pouch is completely divided from the rest of the stomach. Then we go to the small intestine, we disconnect the small intestine, we bring one end of the small intestine up, and we reattach it to the pouch. The other end of the small intestine is reconnected down below. So after gastric bypass, when you eat food, food goes from your mouth into the pouch, then it goes straight into your small intestine. You bypass the majority of your stomach, you bypass the duodenum and early small intestine, and that is where your digestion and absorption occurs, in your duodenum and early small intestine. So after gastric bypass, there are actually two mechanisms whereby people lose weight. One, there's a small pouch that causes restriction, and secondly, we reroute your intestines so you have what's called a malabsorption, meaning after gastric bypass, when you eat food, the body simply doesn't digest and absorb it normally. After gastric bypass, patients typically lose a lot of weight, and they lose it quickly. It's common for people to lose 50 or 80 pounds in the first few months after gastric bypass because they're eating food and the body simply isn't absorbing it normally, and the body relies on the fat stores to fuel the body. After about 6 months, the effects of the malabsorption start to go away, and after about a year to a year and a half, patients typically stop losing weight after gastric bypass.